Welcome to TAS Morning Show. COVID-19 has taken a toll on all of us. It has completely changed the way we live today. Al Raffah, or popularly known as Aster Hospital, has been doing a tremendous job in dealing with the pandemic. To talk in detail, we have Dr. Hemant from Al Raffah. Dr. Hemant, welcome to TAS Morning Show.
Good morning to all the viewers of TAS. Very good morning.
Doctor, could you please tell us what are the plans of Al Raffah to support the medical system in Oman, and do you have plans to open more branches in different cities of Oman?
Yeah, we are right now we are busy with our new hospital which is coming up in Gubra only. As for the information of viewers, I'd like to tell them that we already have 3 units in Oman which is running. Apart from Muscat, we have units in Sohar and unit in Ibri also now. So we are trying to increase the facilities in both the other units. At the same time, we will be shortly commissioning our new premium hospital in Gubra itself. It's about a 140 odd bedded hospital, and this will have a lot of facilities which are not available presently, or very few hospitals have these facilities, like departments of nephrology for kidney patients, dialysis facilities, cardiac facilities for cardiac cath lab, and even facilities of better intensive care for patients, and some facilities like intervention radiology and many other branches like neurosurgery, which we don't have at present. So once this new hospital is commissioned sometime at the end of this year, we should be able to provide all these services to the people in Oman.
Okay, great. And we know that the medical infrastructures needs more workforces. What are your plans to train and introduce Omani workforces to support the healthcare industry in Oman?
Yeah, we have been looking at it because because of this COVID pandemic which has come in. We have had problems in people coming in for interviews and recruitment. So we have, like many other corporates, we have also turned towards the local available talent in Oman. So a lot of our departments, including the non-medical department especially, like the marketing, the people who are licensing, the HR, and so many people we are having, plus our front staff and the front office staff, and so many staff are now they are Omanis, and we are trying to possibly see for our new hospital also. We would definitely be looking at the trained Omani staff like nurses. We already have nursing assistants working with us, and even the nurses, and to
doctors
come and
also,
work for us. Yes,
there is
doctors. In fact, we are having a large number of visiting consultants who are Omanis. So we have a very good sort of collaboration with them, and most of these people are able to provide us expertise wherever it is needed, because previously most of the hospitals, they tend to call visiting consultants but from abroad, but now because of the COVID time it is not possible for people to visit Oman very regularly. So we have local people who are specialized in consultants who come and regularly visit our hospital and provide services to our patients.
Okay, and as Al Raffah has branches in almost all Gulf countries, there is any plan to provide medical network coverage for your customers from one Gulf country when they have the medical emergency while on a visit in any other Gulf country?
Yeah, we would be, we don't have our own sort of insurance system or something, but yes, we have many insurance, I believe, which is pan-Gulf, which covers in a lot of Gulf countries. So we would definitely be providing our services to people who, for example, they coming to Oman on a visit and get stuck with an emergency. So if they have a coverage here, we would definitely provide those services to them.
Okay, and as looking at the possible third wave of COVID-19, what are the medical facilities or medical infrastructures that the hospital should ramp up in order to handle such a situation?
Yeah. As all our viewers know, we are in the middle of a second wave of COVID. Last year we have had the first wave of the pandemic. In the second wave, we have learned some lessons from the first wave, which are very important to implement as soon as possible. We have learned that not only we need to have facilities where the patients are being treated or given treatment for mild or moderate disease, but every hospital should have a stepping up kind of a facility where you have patients who are mild cases, those who become moderate or severe cases. So every hospital needs not only a separate setup for a COVID beds which are marked for COVID only, plus we need to have facilities which are what we call as ICU facilities, in which every kind of patient can be treated. If the patient, because right now what we are facing is patients of mild to moderate cases or even sometimes severe cases we are able to manage. But then in the lack of ICU beds and ICU facilities, sometimes we have to refer these patients out to government sectors and the tertiary hospitals like Royal Hospital. But if in case every hospital is able to increase its number of ICU beds and ICU staff and ICU facilities, I believe all the patients would be able to be treated outside, and especially patients who are expats. Right now, most of the patients who find it very difficult are expat patients because for the mild, moderate or severe disease, they need to have some facility which is outside the government hospital. So we would try to accommodate all patients in near future, but yes, we need to ramp our facilities like you said. All the setup right from simple beds to high dependency beds plus ICU beds are required, and we are doing that. But space constraints and other things are there. So like I said, our new hospital is coming up where we will be having a state-of-the-art ICU. So there we will be able to accommodate patients.
So when will be the soft opening for that?
I believe end of the year sometime.
End of the year.
Because there are certain procedures. Unfortunately, we were very sort of optimistic that we would be able to do that in the beginning of this year. But then because of COVID, a lot of procedures and
delayed
infrastructure things have been delayed. So I hope that by end of this year we should be up and about.
Okay, and Dr. Hemant, even after many months of introducing the COVID-19 vaccines, some people are still confused about the efficacy level of different vaccines. Like, are these vaccines are functioning in the same way? Because we heard that the vaccines are manufactured by different methods. Could you please shed some light onto it?
Yes, I would just like to tell that these are basically, we are fighting a virus here, and basically there are 3 or 4 different types of vaccines which are made for a virus. So if I may simplify this for the viewers, the virus will contain there is a central part which is called the DNA, and there is a covering on the virus which will be made of various things. So
which is the visor that's covered.
I'm talking about the virus. So some of the vaccines will use this central part which is the DNA or a part of it to create a vaccine, because ultimately it is the one which is going to make proteins of the virus, and then the body, when it is given to a person, the body will form vaccine or the antibodies against it. So there are vaccines like Pfizer and Moderna which are using this central part. But there are other vaccines which are being made in which this part uses the central one only, but there is a covering. So this covering is provided by a virus which is a very common but very harmless virus, like a modified common cold virus, which is something like that. So these things are, when they are given to the patients, the same effect occurs. So theoretically the efficacy should be same. The only issue here is that because we are using some viruses to carry the DNA or something, like in AstraZeneca, there is a theoretical possibility that because if suppose there is a common cold type of virus which is being used to carry the DNA, if I am immune to the virus which is carrying the DNA, so it is possible that I may not get the efficacy which I want, maybe 90 to 100% I will not get. So hence, theoretically all the vaccines work in the same manner ultimately, but the efficacy in the various studies has been quoted between 80 to 95%.
Okay, so
but I would just like to say that any vaccine which is available, which has been tested and which has been approved, should be taken, because vaccination at the moment, as we see even today's date, is the only thing that would protect you against COVID. You cannot be sure of any protection or getting only mild. You can get away with a mild or at the most moderate disease even after you vaccinate. But if you don't take vaccine, you can never predict your clinical course. So it's very, very important that whatever vaccine is available, you must be able to take these vaccines for 2 doses.
And regarding the vaccines and taking the vaccines, we heard that maybe we need to take the vaccines yearly to protect ourselves from COVID-19.
That again, I would say that different vaccine, because they have slightly different mechanism of action, I would believe that at present we cannot answer this question. The reason is that we don't have a long-term studies available as to how long the immunity lasts, how long the protection lasts. But hopefully in a worst case scenario, it is possible that in case the immunity falls over a period of say about a year's time or maybe 1.5 years, then maybe like just like for flu, we take a vaccine shot every year. It is possible that we may require it for COVID as well. But as of now, this question is very difficult to answer. If somebody asks me for how long I will be protected, this is a difficult question to answer.
So, and recently it was reported that children might be affected in the third wave. Why is it so, and what will be the impact on children?
See, as the present scenario stands, we will be having most of the children, for the fortunate part was that pediatric age group are not showing any serious symptoms, most of them, and by and large they were protected. Also possibly because of the quarantine or because of the lockdown situations, and because the fact that the educational institutes are closed, the children have not come in contact with COVID in a big way. So it is believed that we really don't know what happens when there is a sort of a community spread among the children. So because by the time the third wave, as it is predicted, by the time it comes, our vaccinations, most of the countries would have had large number of vaccinations which will protect the adult group, 18 plus, 18 years plus. So that is the precise reason why it is felt that maybe if the third wave does come, the children might be a little vulnerable. But I think it is just a concept which is based on some of the theories. It is not that it will definitely happen. But yes, that doesn't mean that we should stop doing prevention and stop taking the normal measures. So it should be done. Hopefully, we should be able to reduce the age of vaccine to even lower, and we should be able to protect the children.
Yeah. Dr. Hemant, could you please tell us what are the precautions one should take post-COVID recovery, and what are all the symptoms one should monitor after COVID recovery?
See, COVID is something which we have seen now, that there are a lot of patients who, after they have recovered from COVID, they tend to suffer from generalized symptoms. Like some people will have cough for a very long time. It's a dry, irritating cough, which may be not be, you can say, infected, but then it stays for a very long time. There are patients who do complain of problems with breathing, especially when they do some exertion. They tend to become breathless. They feel in general that stamina has come down. They feel fatigue. They feel lethargic. There will be muscle pains and so on. Some, very rarely we have seen patients who have had some problems of affecting the nerves and other things, but these are the common symptoms. And after a person recovers from COVID, it is very, very important that he starts all his activities very gradually, because there have been patients or people who have, the moment they have recovered and they have gone home, they have again started going to the gym and started exercising. So I would feel that over a period of a few weeks, people should start
like step
doing
by
their
step
activities, because there have been case reports and incidences where after COVID, when somebody has started vigorous exercise, he has had a cardiac arrest and things like that. So I believe that we should start these activities gradually. People should focus on their nutrition, which is very important. They should continue to take vitamin supplements and have a good nutritious food, because that is what is going to help your recovery from COVID. Most importantly, they should continue to take all the precautions which they had been taking before COVID, because sometimes people get this impression that now they have suffered from COVID, the worst is over, so even if they are exposed, it doesn't make a difference. But that should not be the case, simply because many people now, there are so many different variants and different strains of virus coming in. So you never know. So that is why we should always take all the precautions which are all the time publicized, like maintaining distance, trying to avoid crowded places, wearing masks at all times when you are in public. So these things have to be taken care of. I would like to say that we at Aster we have recognized this problem of post-COVID lung complications especially, and we would be we are planning to have a kind of a lung care program for such patients. It has already started in India, but hopefully we should be always be able to bring it to the Gulf as well. So I hope we should be ready with a post-COVID rehabilitation program for many of the patients by next year.
Doctor, if I will get COVID-19, what do I need to do in order to stop the virus from spreading to my family?
Yeah, this is a common thing which we often find that people, they are staying either with families or they're sharing their apartment with some co-workers and things like that. But what is first important is that the moment you get your test as positive, the first thing is to isolate yourself. And it is not very easy to do it, but it is important to inform your colleagues and your co-workers that you have tested positive, and like you should be wearing mask at all times. If there is an separate room available in the apartment, you must isolate yourself. Preferably, the room should also have a separate toilet, which will be the best thing. And the other people should not either share the articles, whatever I am using, because people who are living together tend to really share certain things, which so personal things have to be absolutely stayed separate. The person who is suffering because he is isolated, all his food needs and other things have to be taken care of by the people who are possibly staying in the same apartment. What they can do is they can leave the food outside his room, and it can be collected from there. To take all precautions, the family members to take all precautions, wear masks, not come in contact with that person unless and until it's absolutely necessary, but wear mask at all times and keep hygiene. Hygiene is a very important thing. Most of the people should have these sanitizer which are available in the house. You should wash hands very often whenever you are sort of touching or going into the room and things like that. It is very important that you also monitor yourself, because merely by isolating yourself it will not help. Your symptoms are very important. I would suggest that right nowadays we are having some teleconsultations available with some hospitals where the physician is able to get in touch with you, and you can possibly take a package wherein the person monitors your symptoms almost every day, and if required the physician will able to talk to you on video call and would like to know what is happening with you, because it is possible that you may have to monitor your fever, so you should have a thermometer at home. You may have to monitor your oxygen saturation, so you should have a pulse oximeter which is easily available, a hand watch which you can put on finger and monitor. So these things are very important to do so that the earliest signs of any problem is there, because what we are seeing now is people isolate themselves and then they just don't monitor themselves. So if they don't have fever, they feel that they are doing fine, and a little bit of cough and they are still continuing, and then suddenly in the night or at odd hours or sometimes they start having breathlessness. And then at that point of time it is possibly a little late. So it is very important that you keep on monitoring. The moment you find that there is a dip, there is a fall of saturation below 94%, you must get in touch with the physician, try to get a consultation as to what is to be done, what medicines need to be given if there is a change in medication. And you should always have a kind of a contact or a line which is to be kept open in case you deteriorate. You should immediately be able to contact that hospital, go to the emergency by informing them, and from there it can be taken up further. But if you suddenly reach a hospital, it becomes very difficult for us. Like our experience has been that patients will just come into the hospital in a very, very bad shape, and then it becomes very difficult because the person does not know where to go. So in case he has a line open, the physician will be able to guide him as to how he is supposed to reach the hospital, when he is supposed to reach hospital, whether the hospital where he is supposed to go is having all the facilities that can take care of him. So all this information, if the person is in a regular touch with physician, even on a video call, he is able to at least have this information, and continuity of care is maintained. Because most of the problem in this pandemic has been that patients who have suddenly deteriorated, they are running from one hospital to another, and the attendants are tired, the patient is in big trouble. But if they have a line like this with a contact with a medical person, and this line is open, they can be immediately guided as to what should be done and how it is to be done. So I would suggest that the person who has a COVID should not only isolate himself, take all precautions, but also have definitely a consultation with a physician, so that his line of continuity of care remains open.
Okay, and doctor, is it right that the virus remains in the body even after recovery for 3 or 6 months? Correct me if I'm wrong.
It is the thing is that because when we are testing for the virus, what we are testing is the genetic material. It doesn't mean that it is an active infective virus. For most patients with asymptomatic, for example, I can be COVID positive, but I don't show many symptoms. I'm hardly showing any symptoms. So after about 10 days, 14 days quarantine, I can join back my work. So if you test me again, I'll be turning out to be positive. But my possibly virus is not infective. That is not an infective virus. But people who have been admitted in the hospital, it is always advisable that they should take at least 3 to 4 weeks away, because they can have the virus for a slightly longer period of time. So they need to take time off from their work who have been positive for at least a couple of weeks more before they can join work.
Okay. Doctor, how did you manage your time between your family, the hospital? We know that during this pandemic, you guys didn't even travel to your countries, and you didn't even get vacation or a holiday. So how did you manage your time?
Yeah, it has been really tough and very hectic actually for everybody. I think it's not just us, because we are in a hospital, so obviously we keep on getting, we are a little more busy. But I believe that most of the people during lockdown also, if you focus on positive things only in life, I think you can get by, because this is a scenario where you tend to become, you are hearing so many things from your colleagues, from your near and dear ones back in the country. You get not very good news, very negative things are coming in. But yes, I think by trying to interact with people, with your own staff and with your colleagues, and always, I think you should talk positive most of the time.
Yeah.
You should not talk negative, first of all. Secondly, you should devote some time whenever you are a little free. You should devote some time to whatever you like to do. I'm very much into music, so I tend to possibly spend some time listening to it, and that takes away all the stress,
The tension
which I
and
have.
all,
Yes,
yeah.
yes. So it does help you. I would suggest that if you are able to put in some time into your hobbies and what you love to do most apart from your profession, I think it will be very positive for people who are recovering also from COVID to get back to work as soon as possible, because it takes a very heavy mental toll. I can tell you that. It does have a very profound psychological impact, especially for people who have been to ICU and then back, because it is something like you have gone to the edge virtually and you don't know whether you will make it or not. So it has a very deep psychological impact. But yes, it does make the positive side of it is that you learn to appreciate life, and you tend to do whatever time you get, you want to spend it in the best way possible, because the future is so unpredictable.
Dr. Hemant, thank you so much for sharing this information, and it was a pleasure meeting you. Thank you
Same
so
here.
much for joining us.
And I would just like to conclude by saying that this is a difficult time, what we are passing through. I would just say that you should all try to spread positivity. For all the viewers, stay safe, stay healthy, and God bless you all.
Thank you so much, Dr. Hemant. Thank you.
Thank you.
I hope this interview with Dr. Hemant has given you more information about COVID. If this video helped you, please do subscribe, like, and share.